Okay. Assalamu alaikum. Okay. We're going to go ahead and get started on our second day. And so we're going to do a quick review of the CARES program, if you will, that we talked about yesterday, and what each letter stands for. Okay? And if you remember, we said that it's like putting the pieces of a puzzle together. The care is individualized for each person. And so we know that it was developed by an international team of experts, so it's what we call evidence-based, okay? So it works in the healthcare facility. The C is to connect with the resident or the person who has the disease.
هو في برنامج موضوع حق حالات الزهايمر اسمه كير ابروش. الكير هذا الاختصاصيين في موضوع الزهايمر، وكلمه كير هي عباره عن اختصار مفهوم شو اللي نسويه مع مريض الزهايمر. اولهم اللي كان حرف السي اللي هي كيف تتواصل مع مريض الزهايمر. الفكره مو انت اللي تفرض رايك على مريض الزهايمر، انما طريقه التواصل هو كيف يتواصل معك.
Okay, and then we also did the activity, if you remember, where you had to turn to the person next to you and really get to know them and ask them specific questions.
هذه كانت أمس المحاضرات اللي هي الوقت كيف يتعرفون على بعض، فكانت هذه أحد الطرق للتعرف على مريض الزهايمر اللي هي إن كيف نتواصل معه وإيجاد الوسائل والطرق اللي نقدر نتواصل فيه معه. أمس اللي سويته الواحد يعرف يعرف شنو هواياته، يعرف شنو هويته. الفكره شو هي؟ انت تعرف مريض الزهايمر قبل ما يصبح مريض الزهايمر، تعرف هواياته، تعرف طباعه، تعرف نومه، لان لما يدخل في مرحله الزهايمر انت خلاص عرفت طباعه وعاداته تتواصل معه وعاداته.
A stands for assess the behavior.
كلمه A اللي هو تقييم سلوكيات مريض الزهايمر. كل مريض الزهايمر وعادة عنده كثير من السلوكيات ويجب أن تعرفها قبل ما تتعامل معها.
Okay. And so you have to assess the behavior for the resident, and when they're doing something that you feel like is not a good behavior or it's a little curious, you have to figure out why they're doing it.
وعادة كثير من سلوكيات مريض الزهايمر غير مقبولة لديك أنت في مفهومك، ولكن هي في الأصل هي عبارة عن تعبير من مريض الزهايمر نفسه. السلوك هذا يعبر عن شيء هو فيه، فأنت لا تتفاجأ أو تنظر لسلوك مريض الزهايمر هذا سلوك غير طبيعي.
And so a good example is if you have someone sitting in a corner and you've never seen this before and they're just rubbing their hand. Okay. R is for respond appropriately.
يتبع قضية الإيمان أو الأسسمنت، كيف راح يكون رد فعلك وكيف راح تتفاعل مع سلوكيات مريض الزهايمر نفسه.
I'm sorry, there's like a sound. And so the primary, yeah, okay. Screen, here's water. It's fun.
Thank you.
Okay. So the primary response for all of you is to provide them with the best approach, okay? And this is only going to work if you make the assessment. And we know that in order to make an assessment, you need what? Time, right? You need time to assess what's going on, and you need time to respond.
هي الفكرة كلها في تقديم أفضل خدمة لك، إنك أنت كيف تدمج ما بين اللي هو الأسسمنت مع اللي هو الريسبوند الاثنين، وهذول عادة ما يتم الدمج بينهم الا اذا كان اصبح لك وقت او اخذت وقت مع مريض الزهايمر نفسه، انك تعرف سلوكياته ثم تعرف شلون تتعامل معه نفس الوقت. طبعا هذا ما قال فيه انه محتاج وقت، يكون لك وقت تقعد مع مريض الزهايمر.
Okay. And then we have E, which is evaluate what works.
عندنا قضية تقييم المريض.
And so when you have to try different things, okay, and this is what takes a lot of time too. And usually what we want to do is, put the person in the corner, put them on the sofa, and just let them sit. But we really need to try different things because sometimes if you do just put them on the sofa and move them away from the environment, they may start to frown and they're not happy.
هي تقصد الموضوع هذا ان تقييم المريض ليس انك تحشره في زاويه او القعده في مكان ثم تطلب منه انه هو يتفاعل معك. ان الفكره شو هي؟ انه تتركه يعيش في البيئه اللي هو فيها ثم انت تراقب رد فعله لانه وضع في زاويه او لانه وضع وسط مجتمع او وضع وسط ناس، شلون يبتدي هو يتفاعل مع الوضع هذا وانت تراقب التفاعل هذا. اللي بناء عليه راح يكون شلون راح تتعامل معه.
And then S, this is the last one, is to share the findings. And so even whether it's in the home or in the hospital, you have to make sure that you keep some type of a journal of what works, what doesn't, the assessment that was made, and then you hand this off to the next person and make sure that they understand that if mom starts rubbing her wrist, okay, if mom starts to kind of move like this, if she starts to wander, this is what we've been trying and it works or doesn't.
حرف الاس هي نتيجة الملاحظة ثم المتابعة. الشغلة الثالثة المشاركة. حرف الاس راح يكون اللي انا نتائج اللي طلعت فيها كيف ابتدي اشاركها مع بقية افراد الاسرة او حتى مع الطبيب اللي لما الحالة تروح المستشفى. الفايندنج اللي طلعت فيه هذه شلون ابتدي اشارك فيه الكوميونتي او المجموعة اللي تساعدني فيه.
And so we're going to go over some slides that talk about improving communication. And so how many of you think that you are effective communicators? Effective communicators, okay. Just in general, yeah? Because communicating on a normal day-to-day basis is very difficult. Yes. And so what do you do when you're angry? Rarely do we have effective communication. Yeah? You breathe, right? And we will talk about that too, okay? And so we also have nonverbal communication. We will talk about this a little bit too. And so we're going to talk about how you need to improve and identify proper ways to communicate. Okay. And so why is communication a challenge? Because what does Alzheimer's disease affect? Okay. And how do we speak? Where do we learn how to speak from? Does it come from our heart? It comes from our brain. Everything ends up coming from our brain, okay? And so we know that communication is going to be effective.
في أعراض مريض الزهايمر، هذه الأعراض هذه هي طريقة التواصل معه. ليس يعني تكون أعراض مزعجة بالنسبة لهم، ولكن هي في الأصل طريقة التخاطب معه.
Okay, and so we've already heard examples of people that are affected with the disease that have inability to find words. Okay, and so if you can't tell me to open the door, how am I going to open the door? Okay. Repetition, the loss of reading and writing, loss of the ability to speak in clear sentences so people can understand, loss of the ability to understand what people are saying to you, and inability to use words. So you don't know how to say door, you don't know how to say cup, bathroom. These things you forget.
مريض الزهايمر لاحظنا في المشكلة اللي نتكلم عنها من طريقة التواصل اللفظي. مشكلة مريض الألزهايمر عنده مشكلة التواصل تظهر بصورة اللي هو أن نسميه لا يجد الكلمة المناسبة اللي يقولها فيسكت أو يتكلم أو تكرار الشيء أكثر من مرة، عدم القدرة على الكتابة نفسها، عنده كذلك اللي هو ما يستطيع أن يتكلم اللغة نفسها، يعني يتكلم حرف ثم يأكل الحرف الثاني أو يتكلم بحرفين ويأكل الحرف الثالث، فاللغة ليست واضحة نسميها. وبعدين استخدام الكلمة المناسبة غير المناسبة في المكان غير المناسب، فيحصل نوع من اللبس. فلاحظ هذه طريقة التواصل اللفظي لمريض الألزهايمر مع الشخص العادي.
And so there's two different types of communication. We have verbal communication, which is being able to choose the appropriate word, okay, arrange the sentence appropriately, and then we also have different dialects that we can use, okay. And so, you know, I don't speak Arabi 100%, but I speak what's called Arablish, yeah, Arabic and English stuck together. Okay, and so some people may not understand that, and I would never speak like that in front of certain people in my community. And then we also have non-verbal communication. When she gets angry, she goes, I don't want to be around when she does that, right? Okay, and then so what about this? Non-verbal communication. During my lecture. What is this?
Boring.
Boring! You're bored. Get up and leave! Right? It's boredom. Okay?
وللألزهايمر هم عنده تواصل جسدي نسميه أو غير لفظي. في راح يكون هو وضعيات معينة تعتبر نوع من التواصل هو ما يستطيع يعبر عنها لفظيا فيعبر عنها جسديا من أحد الحركات اللي سويتها، لكن هنا يعني lectures راح يبين أكثر واحد.
Yeah. Okay, and this I got from the internet. I totally love it because it shows that when we talk about body language, it's not just our body, right? It's our eyes, and we know that the eyes are like the windows to our soul, okay? And so when someone tells you, do you remember that smell of the bread when you walked into the restaurant? And so we tend to go, right? Our eyes tend to go up. Like, we don't go like this. It's even difficult for you to smell and look down. Try it. So you see, and so your eyes tend to drift up, okay? And when someone tells you, you know, think about that one day where we took a walk and you tend to kind of look over to the right. Yeah, I kind of remember that, okay? And so this is just the eye movement. So think about how our body is when we speak. Okay, and then here we have some schematics of body language, okay? And so tell me, what is this? Using a word. Looking for something, okay? And so what about this? Fear. Okay. Good. Okay. And so understand that when you're communicating, you want to take a positive physical approach, okay? You don't want the person not to come near you or to be afraid of you.
المسألة الأساسية في التواصل مع الألزهايمر هي عبر ثلاث صور هو اللي نسميه الوضع أو التوصل للإنسان نفسه. مع الوقت راح تلاحظون مريض الألزهايمر مع المتابعة دائما ياخذ وضعيات معينة يعبر فيها عن نفسه في شيء معين بالذات. مع الوقت انتم راح تصير عندكم حصيلة من الوضع الجسدي في طريقة التواصل مع مريض الألزهايمر. لكن الأصل في الموضوع كيف يكون يصير عندنا مجموعة أو ثقافة لغوية كاملة في طريقة التواصل معها، احنا نسميها positive communication.
Yeah. And so when you communicate with someone either in the hospital or at home, you have to be very careful, okay? Because we already know that changes are happening in the brain. Hello. Hello. How are you? Yeah? Are you doing okay today?
Yes.
Yes? Okay. Is there anything I can do for you?
for me or to do
Yeah.
for something.
And so imagine how she's like, okay, which side? Pick a side. Hello. Okay. And so if you already have cognitive impairment, this is a very wrong approach to take. Okay. It's, go ahead.
كان هذا أحد الأمثلة التواصل مع مريض الزهايمر. مريض الزهايمر دائما معروف أن دائما رد فعله ضعيفة، وإذا تردد أكثر من فعل في أكثر من وقت راح يدخل في مرحلة توهان يتوه الطبيعي، وأنت ما تقدر مريض يحصل يتوه، لأن لو تاه يدخل في مشكلة.
And so what the evidence shows is that you should come from in front of the person. Okay? You need them to see you. And so if their peripheral vision is starting to go away, you really need to walk straight to the front of them. Okay? And some people will knock on the door first because you don't want to startle them. You don't want to all of a sudden appear in front of them. And so you make some noise. You know, hello, it's Keith, I'm your nurse. I'm coming in to talk to you. And then you go in and you repeat the same thing. Okay? Because some things that happen is when you get in front of them, they'll say, who are you? Because from the time you knocked on the door to the time you got in front of them, it's different.
من أحد التواصل الإيجابي دائما مع مريض الزهايمر عبارة عن مقولة بطريقة بطيئة وسلسة. عمرك ما تكلم مريض الزهايمر من الأجناب أو من الخلف، لأن مريض الزهايمر يفقد جزء من السمع، الأطراف عنده هذه ما راح يسمع فيها، عند النظر الأطراف راح تكون بعيدة ما راح يستوعب، فيفضل دائما مريض الزهايمر يكون وجها لوجه. هذه شغلة. الشغلة الثانية نكرر الكلام وببطء. الشغلة الثالثة ندخل بهدوء وليس نسميها اللي هي صدى بشكل مفاجئ. طلقة الباب ودش بطريقة مباشرة، لا يكون سلسة وخفيفة وببطء شديد حتى هو يستوعب.
And then lastly, make sure that you get down on their level, okay? So never tower on top of them. And so if they're sitting on their bed or in a chair, then you just want to make sure that you get down like this, okay? And this is something they teach doctors and nurses to do very early on, how to communicate with just regular patients.
دائما تكونون على مستوى نظر مريض الزهايمر نفسه. عمرك ما تكون أعلى منه ولا تكون في مستوى أدنى، إنما على نفس مستوى البصر. لأنه هو عنده إشكالية السمع وإشكالية البصر، فدائما تكونون أنتم في محور. المحور يكون على مستوى النظر نفسه، لأن الفوكس راح يكون أمام جهة أمام البصر. إذا رحت فوق ولا نزلتوا راح يحدث التركيز.
Okay. And then you always want to make sure that you call them by the name that they prefer. Okay, and sometimes throughout our lives that will change, but understand that you shouldn't do nicknames like, you know, we said in the other class, honey bunches, or cupcake, or habibti, and things like that. You know, address them like they are human, and they're also not a baby, and so you don't want to say, what do you want me to do for you? And so these exaggerated tones, we really don't need that.
مريض الأزهايمر أهم شيء ما عنده يحافظ على قانون، يحافظ على وقار، لأنه وصل إلى سن يجب أن يعامل بوقار، فالأفضل شيء يعامل بوقار. لا نقول عندنا في أعرافنا أبو فلان أو أم فلان، لكن ما تنادي بطريقة طفولية اللي هو قد يكون في حد ذاته يسبب منرفز داخل. دائما نتعامل بما هو نسميه بما يعادل سنة الوقار.
Okay. And then you want to make sure that when you give directions, you do step-by-step directions, okay? And we're going to do an activity right now. It's called the Show Me, Teach Me. And there are some things that are in front of you. And I want you to use your imagination. You can use the spoon. You can use the swab that I have here. And so there's a piece of paper in your packet that has lines on it. And so what you're going to do is you're going to use the spoon and the cup. This right here we use to clean or moisten the people's mouth. Okay? You're welcome.
This one, you mean this one?
Yes. And so what you're going to do is you're going to pretend that you need to do step by step with someone with dementia. Okay, you need to show them how to use this. So we're thinking that cognitively they can still use it independently, okay, but they have some impairment where you still need to give them step-by-step instructions, okay? And we know that you cannot at certain stages say, here you go, I think this will be helpful for you. What are they going to do with it? They might think it's a Q-tip, and you're going to come back and find it stuck in their ear, okay? And so on the piece of paper, write step by step how you will tell someone to do this. And so if you want to imagine that this is a brush for the hair, so write the steps that you will share with them step by step on how to brush their hair, their teeth. And then we're going to go over it and see how accurate you are. Oops. And so I'll give you like 5 minutes to do this. You don't need it? You found one?
الفكرة من هذه نشوف شلون راح يتعاملون مع قدامكم مريض الزهايمر، شنو بالضبط الخطوات؟
And so this, what this is you can moisten it, and and we use this a lot for people in end stages or people that cannot. You can use it on children too. People that they're not allowed to drink fluids, we can moisten their lips and the inside of their mouth. You can use it for cleaning too, or cleaning the mouth, not like cleaning. Dusting the house. Did you do it? Yeah.
To write?
Yeah, to write it on this paper. Okay. And so pretend that this person sitting next to you does not know what to do with this. How will you teach them?
هذه مساحة الحج مربعة. الآن لو اخترتي هذا.
We start?
Yeah.
I don't know.
Imagine.
And so pretend that I have cognitive impairment, and you need to show me how to use this.
I will do in front of you.
In front of me?
Make like this. Open your mouth.
Okay. And so what if I say, I can't do it by myself, I don't need you to do like this?
You can do it by yourself. Yalla, show me how you can do it. I'll do it same like you. I'll tell her like this.
And then I start putting it in my ear.
That's a good idea.
Yeah.
Why don't we start here?
The best daughter.
Imitating?
Imitation, feedback. This is a good one too.
It's exactly how do we treat the people with mental retardation. Because people with Alzheimer, they have mental deterioration. Their IQ became less and less with the progress of their disease. So we have to break each actually skill into small pieces and give them step by step by step.
You do.
Not the whole job.
Perfect.
Actually, this is what I teach.
Good job! We have a winner. She said, I teach this.
Not fair.
She. Yeah.
You are cheating
Yeah. Perfect. And so the important thing to know is that, like she said, you have to break the steps piece by piece and not cluster them together. Okay? The worst thing that you could do is tell someone, go brush your teeth. Yeah, they will probably go into the bathroom and they will grab the toothbrush, and what will they start brushing? Their hair. Brushing, maybe if it's a guy, he will do his beard. Okay? And so you have to break it down step by step. And so who has one that's finished that they can come and share? Did you finish? Okay, yalla. Here. Just make it close to you. You're welcome.
I choose this thing, and I will teach the Alzheimer patient to brush his teeth, let's say, or the remaining tooth he has with the gum. So I think first thing I will show him first this piece, and I will tell him that this is for the tooth, the hair, and the gum. I'll show him like this, and then you need to dip it in a glass of water, like this. And I will bring toothpaste and I will put some of it over the piece. And I will ask him to hold it in the correct way, not of course the opposite way. So he can know that he will hold it in this way. And put it inside his mouth. And then I will ask him, okay, rub it easily over the gum, this side, and then to move to the other side. And I think I need to move it and talk to him slowly. With like correct and obvious words. And then this tooth, you need to brush it more, okay, inside, and then up, and to the other side. And maybe you need to split it, so I have to prepare another empty glass to do this.
And so you're going to be helping them do a lot of things, because you even talked about the toothpaste. Putting toothpaste on this is a whole nother separate step. Yeah? And then putting water in the cup is another added separate step. And so this is something that if you expect them to do, it's more instructions, right? Okay. And then we also know that their patience may run out, so it can sometimes be too long of a process. And we also know that they may need more time. Okay?
So do you advise us to just show them or show the other patient how to use this as a toothbrush? I'm not going to show him how to do the toothpaste or this another.
Yeah, we actually don't put toothpaste on these, but you're using your imagination. But you can, show it to them and show that you can show them how to dip it. Even turning on the faucet is another added step.
Actually, they're bad. Each stage they are. For example, some
Yes.
it's a new little progress. So you guide them in the direction step by step and you need to do it.
Yeah.
And others, you have to do it in the front of them and actually do it together as synchronizing. So you have first to evaluate the patient to know which stage.
Good. And she said that she would do hands-on. Okay? And so she would probably, it depends on the stage, right? And so she would either say, look at me, we will do it together. Okay, so some people end up doing that side by side. You can even do hand on hand. And so if you want to eat, you hold this, okay? And I will come from the side of you, okay, but make you aware that I'm there and hold your hand like this, okay? And we will dip it. And so she feels like she is actively doing it, okay?
كان عندنا الحين اللي هي فكرة شلون نتواصل مع الزهايمر. الدكتورة قالت إن هي عبارة عن درجات. في درجة راح يكون فيها المريض عنده قدرة استيعاب نسميها الخطوات، وهذه راح تكون خطوات قصيرة. ضربنا مثال تنظيف الأسنان والفرشاة. بعض المرات إذا كانت في الدرجات الأولى اللي الاستيعاب يكون موجود نقول نظف أسنان وراح يعرف ايش، لكن في المراحل المتأخرة في حالات الألزهايمر ما راح يعرف ايش معنى نظف أسنان. فنمشي نقسم الأوامر عبارة عن مجموعة خطوات بناخذها خطوة خطوة. في البداية نقول لنا هذه فرشاة، ثم نقول ناخذها نحطها في الحل عشان ننظف. الخطوة الثالثة ننظف الجنبين، بعدين نضرب شوية ماء. لا نمشي معاه خطوة خطوة حسب مرحلة نسميها مريض الزهايمر. فهي احنا الآن قاعد نتكلم تقريبا معظمها في حالات لما يصل إلى مرحلة الزهايمر لمرحلة ان قضية الأمر نفسه ما راح يفهم شيء الفكرة مثلا. في كثير أو معظم حالات الزهايمر في مراحل متقدمة ما يفهم الأوامر. ففي دور يكون مكلف مريض الزهايمر يبين له بالضبط الفكرة مثل شيء ويمشي معاه خطوة بخطوة عشان يعرفها. لأن المريض الزهايمر نفس الخطوات هذه إذا سواها اليوم راح تنساها في معنا مريضين. فهي الفكرة ترتيب الخطوات معه بطريقة سلسة، هو يستفيد منها وكان يستفيد منها بطريقة سهلة. صوت مواصل؟
What? So make sure that you speak slow and clear, okay? It doesn't mean to shout because that's very unpleasant. And so you just speak very slow and clear, okay? And then ask for exactly what you want and say exactly what you want, okay?
مريض الألزهايمر دائما نتكلم معاه بطريقة بطيئة ويبين بالضبط اللي احنا نبيه شنو بالضبط. شو المفروض هو اللي يسويه؟ لا تتوقع مريض الألزهايمر ان انت قاعد تعاملون مع مريض انه يفهم ما احنا نسميه بطن الكلام. لا، المفروض ان الكلمه خطوه بخطوه خطوه بخطوه عشان يعرف بالضبط من غير هزه، من غير صوت عالي. صوت عالي بعض المرات يهزه ولا صوت واطي ما يسمع همه، انما يكون في حدود سمعه بطريقه سهله.
Okay. And so now we're going to move over to the next part, which is understanding the behavior of the person with the disease. And I want you to know that Alzheimer's is going to affect every single person differently. Okay? And so some of you came up to me and said, you know, I would like to know what part, what stage my loved one is in, or my mother or my father or this patient. And there might be some type of overlap. Okay? And so there's going to be certain behaviors that you will see in, for example, stage 4 that's going to overlap into stage 5 and further down. And so we already talked about the common signs: memory loss, disorientation to time, person, place, language problems, the inability to concentrate, and then the visual spatial perceptions. Okay, we talked about the shadows, the shiny floors, how it looks like water, how the shadow makes it look like a hole in the floor, difficulty completing complex tasks, and then the personality changes that are going to occur.
مريض الألزهايمر دائما عنده سلوكيات، راح تصير عنده سلوكيات. مسبب السلوكيات هذه شنو؟ هي عبارة عن أعراض العته اللي يحوشها مريض الألزهايمر، اللي هو أنه يفقد الذاكرة، ما يعرف الأفراد اللي حواليه، عنده مشكلة في التواصل، عنده مشكلة في التركيز، عنده مشكلة احنا نسميه في البعد البصري، والنظر عنده زين، لكن عنده إشكالية في البعد البصري اللي هي تقدير الأحجام والأشكال، بحيث إنه لو نظر من الأرض ما يقدر يعني يبدل المسافة، أو إنه إذا شاف شيء لامع ما يعرف الشيء اللامع هذا هل هو لامع ولا هي وقعت معه الجدام، أو إذا كان في ظلال عندنا ما يعرف يميز الظل من عتبة مرتفعة غيره. وعنده كذلك مشكلة في السلوك اللي احنا نسميه السلوكيات نفسها. هذول راح عبارة عن راح يأثرون في تصرف المريض الألزهايمر اعتمادا على مجموعة الأعراض هذه.
Okay. And then the common behaviors that we're going to see are walking about. Someone gave me a really good example of how who was it? Your mom, you guys were on the long airplane ride, yeah? And she was probably restless, and she put her mother in a wheelchair, and you were getting ready, I guess, to go back to the hotel, yeah? And in a blink of an eye, because that's how quick it happened, right? Her mom wandered off. And what did you do? You got panicked. She was like, oh my God, where did my mom go? Yeah, and where was she? Where was she? She was right there.
Right behind me.
Yeah. Okay. Exiting or trying to leave, wanting to go home. So even if the person lives there, they want to go home. Okay. Showing fatigue, restlessness, sleep disturbances. Sometimes they're gathering things, they're shopping, if that's what it looks like. Hallucinations and delusions. Being suspicious and paranoid, which really affects the family because they think that you're trying to hurt them. They think that you're trying to steal from them. And so it's an unpleasant feeling to be accused like that.
تكلمنا عن اعراض العزة الزمام خلال القراءة، عدم التعرف على الاشخاص، عدم القدرة في التخاطب والكلام. شنو السلوكيات اللي تظهر ورا موضوع العزة هذا؟ راح يظهر عندنا مسألة ان الشخص يتحرك بغير هدف بحركة مستمرة، هذه من احد السلوكيات اللي يكون عندهم كذلك مسألة انه يبي يروح البيت، مع انه عايش في البيت، لكن على طول الغضب بروح البيت. هذه احد السلوكيات. السلوكيات الثانيه اللي هو عدم انتظام النوم، الليل نهار والنهار ليل، الوضع مختلف تماما. عندنا مشكله احنا نسميها الهاوس السمعيه والبصريه، الشك في افراد الاسره ان حد ما يقبلوسه، انه هذا جاي يتذكر، الامور هذه تكون كلها موجوده في مريض الزهايمر نفسه.
Okay. And so we need a different way to think about it because we're the ones that are really going to understand what's going on. And so wandering, we're going to think about as walking about or being mobile. It's actually a way to release energy. And so as long as it's not unsafe, okay, because her mom wandering was not unsafe. It was just in an unfamiliar place. It happened to be the wrong place, okay? We have also sundowning, and so when you don't allow time to transition from daytime to nighttime, and you're rushing the person to get into bed, and they may not be ready, they haven't transitioned. And so we're going to think of that as them being tired, because they are tired, they do want to go to sleep.
السلوكيات اللي تحصل مع مريض الزهايمر كيف نحول السلوك السلبي الى سلوك احنا ممكن نستفيد منه؟ احنا قلنا ممكن نتحرك بحركه دائمه مستمره من غير هدف. فاحنا ممكن امامنا حلين، يا اما نحشر بزاويه والقعده وكذي هم نفقد مساله التواصل، خلينا نستفيد من السلوك هذا، نخليه يتحرك في بيئه امنه لا يتعرض فيها الخطر او يؤذي غيره. ليش يصير بعد ذلك؟ هو راح ينتج طاقه، يتحرك لما ينتج الطاقه هذه يعني نسوي تمرن بطريقه غير مباشره. الحركه هذه تخليه هو يتمرن في المكان، موجود فيه بطريقه غير مباشره. عندنا كذلك مساله ان المريض لما يختلف عنده مساله النوم، شلون نخليه انه ينام بوقت معين. في عندنا مساله اللي هي الظروف، استغلال الوقت اللي هي ما بين الوقتين نسميه. يستفيد من مساله كثره الشمس هذه، نبتدي نعلمه ان هذه حسه النوم. انت المفروض تنام بالوقت هذا وقت النوم نسميه. فتلقاه بشكل تلقائي، مجرد ما تنكسر الشمس داخل فتره الغروب عنده يعرف ان هذه خلاص حسه النوم، لازم يروح يبتدي ينام. فنستغل السلوك اللي قد يكون مزعج لنا بطريقه ايجابيه في مريض الزهايمر نفسه.
Yeah. What am I looking for? Yeah. And so how many people have had family members do that? They're looking for something. And you go up to them and you say, what are you doing? What are you looking for? My car keys. You haven't driven in years. Is that what you tell them? You haven't driven in years. There are no car keys. What do you, put the purse away? Or do you just let them finish? Yeah, it's okay. It's not hurting anybody, okay? And then you can also try to redirect them, okay? Here, let's look over here. Maybe it's in the living room, okay? And then you take them into the living room. Or let's take the bag into the living room where you can sit down and maybe take things out and then put them back. Okay.
من ناحية السلوكيات المريض الزهايمر إنه يجمع الشغلات دائما يفتش فيها. بالنسبة لنا هذا يعتبر سلوك يعني منرفز، لكن خليه نستغل بطريقة إيجابية، نخليه يدور بالشغلات القديمة هذه، ونستغلها كذلك في مسألة إنه بدل ما يفتش فيها له وقت ممكن نمسك إيده نوديه الصالة يفتش فيها هناك براحته، ورد يحطها في الجنطة، ويرجع يطلعها من الجنطة، ورد يحطها في الجنطة، عبارة عن تدريب سلوكي له هو، يستغل وقته، وكذلك إنه ناخذه بطريقة يعني إيجابية وسلسة في الموضوع.
أنا ما كنت شيء غير مختلف شوية. As if it's not right to say, no, you are not driving anymore, or you don't drive. You have to be driving for 3 years, there is no happening. And then this is not good because you have them. So he said, yes, slow.
Yeah.
And we look with them, although we know they have no key.
Yes.
So it's not that to actually use it and then say that you feel it is to go with them.
Yes.
As far as help them.
Yeah. Yes, that's exactly what it is. It's almost like you're acting, okay? And a lot of people fail, and I hate to use that word, because they don't understand that acting part. You know, they become, in essence, they're not seeing it as a disease, you know? And so that's where we start to get into trouble. But yeah, you will tell them, you know, yeah, let me help you look for the keys. Let's see where they're at, okay? And the other reason why you don't want to say, there are no keys. You've been looking in the bag for the past 30 minutes, there are no keys. They will start to get very upset. And this is a battle we will never win. And so here's an example where someone goes to Emma and says, stop putting ketchup on the ice cream. She's eating ice cream and she's putting ketchup on it. And someone else says, stop it, what are the people going to say? And then she says, stop shouting at me. So now she's getting upset. And so what's wrong with putting ketchup or mustard on the ice? It's disgusting. You know, it's preference. But what's wrong with it? Nothing. Is it hurting anybody? Doesn't hurt anybody. Okay.
بعض المرات السلوكيات اللي يسويها مريض الزهايمر في البداية اللي هو غير مستساغة من الشخص المقدم الرعاية. فهي طرحت مثال لي ان في قاعده تحط الكاتشب على ايس كريم. بالنسبه لنا عباره عن سلوك مستهجن، شلون الكاتشب على ايس كريم؟ الفكره كلها شنو؟ نخليها تنفذ الامر على اساس ما ندخل في اهم شغله عندنا مع مريض الزهايمر، ما ندخل في جدال مع مريض الزهايمر. لا، اذا ما في ضرر في الموضوع خلينا ننفذ الامر بطريقه سلسه حتى ما ندخل فيما هو اصعب من اللي هو الجدال اللي عمره ما راح يعني تفوزين في مساله الجدال مع مريض الزهايمر.
Okay. And then when our behavior is a problem? When they violate someone's rights, okay? When they pose a threat to someone's health and safety. And so we mean your health and safety, and then the person who has the disease's health and safety, including that person. And so that's when it becomes a problem, and you need to go back to the CARES, the CARES, and assess the behavior, respond to the behavior, okay? Evaluate the behavior.
دائما في السلوكيات مريض الزهايمر ينفذ كل السلوكيات اللي هو يبيها، ما عدا اذا تعرض لشيء، اذا تعرض لذاته بمعنى خطر على نفسه او في كان خطر على غيره. في المرحلتين هذه نتدخل في منع السلوك. ما عدا ذلك يفضل نترك المريض انه يتصرف براحه تامه.
Okay. And so we're going to understand some of the behavior. What are some, because changes and things that are responsible for the behavior come from everywhere around us. And so we have the person's health and comfort, okay, which can cause different behavior. Think about the last time you were tired. Think about the last time you had diarrhea or you were constipated, okay? And think about the last time you were sick. Think about the last time you were depressed. You were able to manage it somewhat, okay? But they cannot, and they're relying on someone else to identify that this behavior is going on and to find some solution.
بعض الأمراض يحصل سلوك غير مرغوب فيه من مريض الألزهايمر نفسه. نبحث في الأسباب عادة. احنا قلنا في البداية أن كيف يعني تبين مريض الألزهايمر نفسه. ففي كثير من الأعراض يؤدي إلى سلوك غير مستحب أو غير موجود أو سلوك جديد يظهر على مريض الألزهايمر. ففي عدة أسباب تسبب السلوك هذا نفسه. في عندنا اللي هي أسباب صحية مثل عندنا الإمساك، عندنا التعب، احتمال يكون مريض، احتمال يكون عنده أي مرض ثاني موجود، احتمال أحد أعراض الاكتئاب نفس اللي مصاب فيه، أو تكون بأسباب بيئية يكون عنده مو سبب انه يعني صحي، احتمال انه يكون في عندنا ازعاج شديد مثل التلفزيون بصوت عالي، او يكون عندنا ننتقل لبيئه جديده غريبه عليه اول مره يشوفها، او انه يكون المكان نفسه مزحوم في شغلات وايد تؤدي الى نقص.
Okay. And you know, being a caregiver is more than just keeping an eye on the person, right? We're like little detectives. And so we have to use what's called the cues and the clues model. We have to ask a lot of questions. Who is this person? Okay, it could be your grandmother. And what is the behavior that concerns us? Because it has to be a behavior that is upsetting the person. We're not really necessarily concerned with how we're feeling. So if it's upsetting us, we're not going to change the behavior. When does it happen? Where does it happen? Who is the person with when it happens? Because sometimes behaviors will happen with a specific person, okay? Not every caregiver. And so we have to ask ourselves all these questions.
دائما مقدم الخدمة يكون يلعب دور نسميه المخرج مع مريض الألزهايمر. دائما مريض الألزهايمر بالنسبة له شيء جديد. كل يوم راح يكون عنده شيء جديد. الفكرة بالنسبة لنا احنا ان المريض الزهايمر نتابعه بشكل يومي في كل سلوك يظهر عنده، نبتدي نفكر السلوك اللي ظهر الجديد اللي عنده شنو سببه؟ ليش حصل؟ كيف حصل؟ وشنو تأثيره علينا احنا؟ كيف راح يكون تأثيره عليه؟ فدائما نسميه العين الساهرة على مريض الزهايمر لا يتوقع ليش ما يقولنا في البداية مريض الزهايمر يبتدي يمكن ياخذ لمدة 20 سنة في المرض هذا. وهو متغير، اليوم راح يطلع عنده شيء جديد، اليوم يطلع عنده سالفه جديده. فالفكره انك تكون عينك على المريض بشكل مستمر ويومي، وتسجيل اي سلوك جديد يطلع حتى لو كان صغير.
Okay. And then you have to have quality interactions, and so affirm their feelings. I understand. I'll sit with you. We will cry together. We will laugh together. Let's have fun together. Okay. Show empathy, solve the problems whenever possible, and you can use distraction and relocation.
دائما اللي يتعامل مع مريض الزهايمر ما يتعامل معاه نقول بطريقه سلطويه، بمعنى ان العياله او ان الكبير الصغير، انما يقصد مع مريض الزهايمر انه يكون تعامل احنا نسميه عندنا في بيئتنا الاخ مع اخوه او الاخ مع اخته، يعني يتفاعلون في الشعور مع بعض دائما على طول، يعني يكون كانه النصيب ماله بالسلوكيات مالته.
Okay. So now we're going to talk about caregivers. And so here I have a definition of caregiver in the United States versus the UK. And here the USA defines caregiver as the unpaid relative or friend of an individual who helps another individual with his or her activities of daily living. And in the UK, it's also someone who is unpaid to look after the ill, the frail, or the disabled.
هي الآن تتكلم الشريعة هذه عن قضية من الذي يعتني بالزهايمر؟ يعني نوعين، نوع يدفع له يعني يقدم الخدمة بالمقابل، وفي نوع احنا نسميه يكون الذي يعمل من غير مقابل. وعادة احنا في بيئتنا الشرقية الذي يعمل من غير مقابل الزوجة، الزوج أو الأخ أو الأخت أو الأخ، فهذول احنا نسميهم مقدمين الخدمة من غير راتب. في ناس ثانيين طبعا دول أوروبية والأمريكية بشكل عام عندهم مسألة إنه يقدم الخدمة براتب أو بفلوس.
And then just some numbers here. 6 million people in the UK provide care on an unpaid basis for a relative, friend, or neighbor that needs support due to old age, disability, or because they are frail or ill. Okay, so this is a lot of people, 6 million people. 6 million, yeah? And so this is not a healthcare provider. It's not a nurse. It's not really someone, it's just a friend, family member. So it's a lot of people. And so what we need to do is we need to really think about the population. For example, here at Kuwait, how many baby boomers are we expecting? And so we have epidemiologists, hopefully, that are working in the country. Where's the epidemiologist? Where? Who? Oh, yeah? Okay. Yeah, and so they are trending the aging population. And so, you get ready. What you do is you start educating people on it. And so all of you are now educated. You have the foundation, the knowledge. And then you start working with the physicians. You start working with the nurses, physical therapists, nutritionists. I mean, it's on and on and on how many people are involved in this.
هي باختصار نقولها في موضوع تقديم الخدمة. الزهايمر دائما مو شخص واحد يقدم الخدمة دي، دائما يكون في عندنا شغله نسميه اللي هو عمل جماعي، عبارة عن أفراد عاديين إلى جانب طاقم صحي يساعد الناس العاديين في الخدمة. الخدمة طبعا بالنسبة لهم هناك دولهم منظمة بطريقة معينة، الخدمة موجودة هي كذلك نفس الشيء موجودة ومتوفرة، لكن البيئات الشرقية دائما الأسرة هي دائما العنصر الأساسي اللي نسميه يقدم الخدمة في رعاية الزهايمر.
And so who are the caregivers? You have the primary family, the husband, the children. You have tertiary family, the grandparents, in-laws, aunts and uncles who will be helping. And you have secondary family, who are the mothers, the fathers, and the siblings. And so you see there's a lot of people that are involved in this. How many people say yes?
الصورة هذه تعبر بالنسبة لك.
How many people have felt like that? And it's okay because the feeling is okay. So how many of you have felt like someone is squeezing you on this side and on this side? Yeah, I felt like it before. Okay. And so there is this definition that came out in 1981 called the sandwich generation. And so this is a generation of people who are now caring for their aging parents. Okay? And so you're aging, and your husband is aging, and you need to deal with your own health. And now you're dealing with aging parents who really rely on you and need you too. And so this is where we have sandwiching. And your kids rely on you for a lot of things too, maybe a little bit too much. And so where we start seeing, if you can reflect just for a moment back to the stages 1 through 7, okay? The middle stages are pretty, wide, okay? And so a caregiver in the middle stages really has to work through a lot of things. Okay, and so many families decide that keeping their loved ones at home is just not an option any longer, or they need to rely on more people. Okay, and so if it's not an option to move a patient to an acute setting or a nursing home, then you need to make a decision to bring more people in to help you, because you cannot do it by yourself. You already said it? He's ahead of me? Okay. And so understand your daily plan is as important as their daily plan. And so don't just focus 100% on them, because you need to have a life and enjoyment and do things for your family as well.
نصل لمرحلة أن نقدم الخدمة، قاعد يقدم الخدمة لمريض الألزهايمر. هل المفروض يكون متفرغ تماما لمريض الألزهايمر ولا لا حق عليه نفسه هو كذلك؟ فالفكرة كلها أنه هو لا حق على نفسه. فهني جاءت الفكرة في أن احنا نسميه الأسرة وبقية أفراد الأسرة يساعدونك في العناية بمريض الألزهايمر عشان أنت تاخذ راحتك وتتنشط عشان تقدر تقدم خدمة لمريض الألزهايمر.
Okay. And so what happens in the late stages? Think about stage 7.
مريض وصل المرحلة السابعة.
Hand down.
شلون؟ شو يصير؟
What happens? What does the person do?
شو السلوكيات تعالى؟
They can't control themselves. Okay. They can't swallow. And so we have a decline. Yeah? We have a decline. They're very heavily dependent on the caregiver. Okay? They may have incontinence, fecal incontinence, urine incontinence. They cannot move. You may need to start moving their extremities because they're going to start atrophy. Okay? And so understand that no matter what you and your doctors try, in the end, the disease is going to progress. Okay? And you have to understand way in the deep of your heart that you did all that you tried to do. You gave it your all, your 110%. Okay? And so don't feel guilty about what's happening.
دائما في المرحلة النهائية لا تستطيع أن تقدم الخدمة لمريض الألزهايمر لوحدك، لأنه راح يبتدي يدخل في مشاكل صحية ومشاكل نسميها حركية أنت بنفسك ما راح تقدر تقوم فيها. فلا تدخل في مرحلة نسميها عقدة الشعور بالذنب، أنك أنت إذا ما قدرت تسوي له هالشيء معناته أنت مقصر معه، مع أنك أنت مقدم الخدمة 100%، لكن أنت شيء فوق طاقتك، خلاص أنت وصلت لمرحلة هي فوق طاقتك. فهني أنت المفروض تتقبل الوضع كما هو وتشارك الفئات اللي نسميها المحترفة بمعنى أصح اللي ممكن تساعدك. يعني هي تكلمت عن نقطة بدأ يعاني من صعوبة بالبلد ما قام يبدأ، فأنت ما راح تعرف تأكد. المفروض شلون تدخل المستشفى يا أقول النيزل جاستريك أو أقول أصبح ما يستطيع الحركة، فأنت محتاج جماعة العلاج الطبيعي يساعدونك في توفير التمارين الرياضية. دخل في مشاكل سلوكية شديدة جدا أنت ما تقدر تتعامل معها، المفروض يدخل عند الطبيب النفسي يعطيك مجموعة من الأدوية عشان يهديك. فأنت المفروض ما تتوقع على مريضك وتنساه وتبتدي تشعر لا تتقبله كما هو بأعراضه وتشارك الآخرين المحترفين اللي يساعدونك في الموضوع.
And you know, there's other things that you can do in the final stages, and we see this a lot with the people who are near the end stages of death. Okay, we get the family around the bed, they sit there and they still talk to them. You know, I'm here with you, Mom. You know, my brother Ali is going to be coming, and so you know, we're going to take care of you, and the grandkids are going to be coming to visit you too, and you can hold their hand and you can give them things to touch. And so we keep on caring for them all the way until the end.
وفي نقطة في المرحلة النهائية بالنسبة لك في الستيج النهائي بالنسبة لك الزهايمر هو لما يفقد القدرة على الكلام أو التواصل لا تعتقد أنه ما قاعد يتواصل معك، إنما هو ما يعرف طريقة التواصل معك. فلذلك إحنا اللي المفروض نستمر بطريقة أقوى في التواصل. ممكن نتكلم معه السوالف اليوميه اللي قاعد يصير، ممكن اللي هي مساله التدريب على المساعده اللي دائما نسويها على كبار السن، نتكلم معه. هو ما زال يتلقى الاوامر هذه، لكن هو ما يعرف كيف يتفاعل معها. فانت ما تقطع مثل ما نقول، لا تستمر في اللي هو احساسه انه ما زال موجود، وانت ما زلت حواليه اصلا موجودين.
معناتها ان مريض الزهايمر I have to keep in communication, okay? طيب إذا هو ممكن he can hear me, he can feel what between him and me. How come أنا ماني قادر أستوعب؟ شلون هو يحس فيني وما يقدر يتواصل وياي؟
احنا قلنا مريض الزهايمر شنو مشكلته في النهايه؟
اوكي، ما هو العقل مسؤول عن شغلتين، اوكي؟ الاخذ والعطاء، انه يتقبل، يستقبل ويعطي. معناته الان مريض الزهايمر ما يعطي بس يستقبل فقط يعطي. لا
في المراحل النهائيه،
في المراحل النهائيه يكون بس مستقبل، ولكن ويدرك. هل هذا الاستقبال في نوع من الادراك؟
نعم في نوع من الادراك.
في نوع من الادراك.
اللي حصلت هو تدهور عقلي عن السابق، بس بضل تخيل طفل عمره 8 شهور، مش لما بتحضنيه وبتسبيله وبيرتاح. هذا خير.
هذه بادي لانجوج اكثر ما انها
مش بس بادي لانجوج، هو بيحس وبيفهم.
نعم.
انت مش زعلانه او انت مبسوطه منها.
نعم.
تخيل انه عمره العقلي صار عمر ابن سنتين، من بعد ما كان انسان كامل صار عنده تدهور عقلي بعد المرض، وصار عمره العقلي سنتين. ابن سنتين بيفهم ولا ما بيفهم؟ بحس ولا ما بحس؟ بيفرح ولا ما بيفرح؟ بس هم احيانا لما مشكله الزهايمر الذاكره بتسألهمش الذاكره يجيبوا الكلام المناسب عشان يردوا عليه. احيانا بيجيبوا اي كلمه وبلخبطوها عشان يكملوا جملهم، فبتصير عندهم اللغه الغريبه اللي بنسميها الواتساب.
And so you should always try to stimulate them. Even though we say that the brain has atrophy, that the brain is getting smaller, and that the synapses is not working in the brain, you still cannot deny them this type of activity up until they take their last breath. Right? Even though they may not be giving you feedback, you giving them, right? You're like this. You're holding their hand. Right? And you can even be massaging them. Okay? But how do you know they're receiving that? How do you know? You don't.
هي الفكره وين؟
Actually, it's not happening. My father now has a stroke, and actually he can't leave the bed. And going to I know him, he said, I went for a walk today. Or when he's in bed and I'm next to him, takes out the cover. He said, I just wanted to get out of it. I said, okay, well, I'll get something. But actually, he's not aware.
Right.
Even if you're talking to him and he's, okay, he will say like 2 or 3 words and then he'll stop. But I think he means to respond, but it's not coming out.
Yeah, and you know, he had a stroke. Yeah, and so this is just a little bit different, okay, than a form of Alzheimer's, okay. But specifically, I just want everybody to know that in the body is still a soul. Okay, and we have to keep treating the person with dignity, even if they do not give us something back. And so humans always wait for something, right? We always wait, okay? I'm giving you something and you have to give me something in return. Well, this is totally different, okay? If you're waiting for that, you're never going to get it. Never. And so we're going to give emotion, and we're going to give touch, and we're going to speak to them, and we're going to make them aware of what's going on, even though they don't let us know that they know what's going on.
He had a stroke, but he had a lot of that.
He still had Alzheimer's disease, yeah. Yeah, yeah. So how many people have felt like this?
هي الفكرة لا تتوقع أن مريض الزهايمر راح يعاملك بالمثل. هي الفكرة كلها أنك أنت تقدم له بغض النظر هو استوعب ولا ما استوعب. يعني أنت تشعر بوجودك وحواليك. أنت كخدمة إنسانية أو إحنا نوع من باب إحنا نسميه التواصل فيما بيننا، يعني طريقة من طرق التواصل. لا تتوقع أن مريض الزهايمر أنه ممكن يتجاوب معك، وانه اذا انت تطلب منه شيء هو المفروض يرد عليك او يتعامل معه. فلا تدخل انت، احنا قلنا في البدايه لا تتوقع ان مريض الزهايمر راح يتعامل معك كما انت تتوقع. فانت دائما مريض الزهايمر احنا شفنا في البدايه نشوف سلوكياته، قد هو سلوكه ما يتجاوب نفس الطريقه اللي معك فيها، هو قد يتجاوب بطريقه ثانيه، انت مو مجبر انك انت لازم تقبل منه. في عندنا نقطه ثانيه في الزهايمر، يعني يقولون ليش هو ما قاعد يحس فيه ولا لا؟ احنا قاعد نقول نقطة أساسية إن طريقة التعبير مفقودة عند مريض الألزهايمر. هو احتمال إنه ما راح يتعامل معه، هو يحس عنده الإحساس موجود، لكن كيف راح يعبر عن نفسه؟ هل يعبر عن نفسه بسلوك غير طبيعي أو رد فعل غير طبيعية أو إنه يكون كارث ما يحتاج هو كذا. فأنت لا تتوقع منه إنه لازم يتعامل معي بنفس الطريقة.
Yeah, and so you.
ما في فيدباك، يعني انت المهم انه احنا ما ننتظرش فيدباك انه استوعب فهم استفاد ما استفاد، لا، بس احنا لازم نثبت اللي عندنا وما ننسى انه هذا انسان مثلنا مثله ونتذكر كيف كان قبل المرض.
Yes, absolutely, and that's why we don't treat the disease; we treat the person. Yeah. So moving on, how many people have felt like this? Yeah, they have their coffee. They're trying all the time. They have the steam is coming out of their, and they're just saying, "I'm just a little bit stressed." Okay, so just leave, and nobody's going to get hurt. And so this is a way to manage stress. Okay, and so here what you have is someone who's screaming, and so they're very stressed out. And this is all the different ways that they're going to manage their stress, okay? Because you're going to have to manage your stress, and it cannot be by internalizing your stress. Because what does that do? Yes, yes, yeah. And you cannot be the best caregiver when you don't take care of yourself. And so, go ahead. The picture. Okay.
دائما المقدم الخدمة لا يستهلك نفسه استهلاك ناجح، انه يترك مجال لنفسه حتى يقدم.
Okay. This is a caregiver stress checklist. So just tell me yes or no if you have encountered this at some point. Do you feel like you have done it all yourself, but that you need to be doing more?
الجواب على السؤال بنعم أو بلا. هل أنت فعلت كل ما تستطيع لمريض الألزهايمر؟ هل تشعر أنك أنت قدمت شيء؟
So I know I take care of my father. I go to all his appointments, and sometimes I do feel like I should be doing more. It's just the habit of the beast. So I say yes. Okay. Do you withdraw from family, friends, and activities when you used to enjoy it?
هل تبتعد عن المحيط الأسري أو المجتمع حواليك عشان بس تقدر تسمع مريض الألزهايمر؟
And so what happens sometimes, and so what happens is we feel guilty. They're at home, someone else is taking care of them. They're now becoming a burden, okay, to someone else, and now I have to go and have pleasure, go shopping, watch a movie. How can I do that? Do you worry that the person you care for is safe?
هل تعتقد أن مريضك اللي تتعامل معه هل هو في أمان من غيرك؟
And so an example for this is if you're at work, you're constantly thinking about them. Are they safe? Is the person that's taking care of them making them safe? Are they watching them? Do you feel anxious about money or healthcare decisions? Not so much.
توفير وسائل مالية ووسائل علاجية حقها. كل تفكيرك الآن لازم نوفر له بجت أو ميزانية معينة عشان شغلة معينة، أو نوفر له شغلة معينة عشان شغلة معينة.
And do you deny the impact of the disease and its effect on your family? So you're denying the impact of the disease. You know what's going to happen, but you're in denial.
دائما تعيش في فكرة أن المرض هذا ممكن يعني يتعالج، ممكن يشفي، إنه خلاص نعيش على أمل إنه يوم من الأيام راح يرجع مثل ما كان. تعيشون بالفكرة هذه يعني مريض الألزهايمر ممكن يرجع مثل ما كان.
Yes. Because we know denial is very dangerous. Okay. Do you feel grief or sadness that your relationship with the person isn't what it used to be?
هل تعتقد أن علاقتك مع شخص مريض الألزهايمر تأثرت؟
Yeah.
تشعر يعني نقصد بحزن بأسى أن كان إنسان نشط وممتاز فجأة انتكس وأصبح يعني يأخذ جزء كثير في الموضوع. ليش هو صار كذي؟ هذا يسمونه إنكار الذات. لا هذا يكون من نقطة إنكار الذات. إذا تفكر بطريقة شديدة تدخل في مسألة إنكار الذات. معناته أنت ما تتقبل المرض. الفكرة منها أنك أنت ما تتقبل المرض.
And so it's very difficult. So if any of you had the opportunity, because it's rough, and so if any of you had the opportunity to care for someone who is chronically ill, okay, you know that it's very difficult. You know, if you've ever taken care of someone in the end stages of cancer, if you've ever taken somebody, you know, who had a brain tumor and then after surgery did not do well, okay, and so you have to understand that you're going to care for them and do as much as you can. Okay. Do you get frustrated or angry when the person continues repeating things or doesn't understand or doesn't listen?
No, I don't.
She doesn't. No.
لو مريض الزهايمر قام يكرر نفسه ويكرر الخطوات ويكرر الكلام بطريقه متواصله، هل السلوك هذا لو كنت ما تعرف ان هذا السلوكيات راح ينفذك او يكون دورك؟
And so a lot of people said no, and this is a good response, but the people that say yes is because they don't understand that the person is not doing it intentionally. Okay? They're not thinking, I think I'm going to ruin her day today, and I'm going to have her repeat everything 5 times. Okay? So it's not intentional. Okay? And do you have health problems that are taking a toll on you now? And so you neglected yourself, and so now you have health problems.
هل بيكون العناية بمريض الألزهايمر من أسباب صحتك؟ بمعنى أنت لو كنت تعاني من مرض الله يبعد الجميع عن الضغط ومن السكر راح تهمل العناية الصحية في نفسك عشان بس تتفرغ على مريض الألزهايمر، ولا أهم تعتني بصحتك؟
Sometimes we delay.
Yeah. Sometimes we delay. Yeah. And so sometimes that delay can be years. Yeah. And then we don't feel like it's years. Yeah. Wait. Say it.
In Arabic, okay.
In Arabic.
قوليها بالعربي.
إن يكون الأهل هم يعني أكثر ناس يهتمون، يعني المفروض مو الممرض ولا الدكتور حق مرضى الزهايمر.
هي هذه الفكرة.
أي.
إن الكير جيفر دائما عندنا.
الأهل أول شيء بعدين يجي الصحة.
صح.
And so what do you do to de-stress? What do you do? Or de-stress? She travels. That's a common thing in Kuwait.
I wish I can travel a lot.
What do you do?
Me?
Yeah.
I don't know.
You don't know?
No.
Okay.
No, when I am stressed.
When you're stressed out.
I would go and would just have a walk.
Oh, that's good. Having a walk, clearing your mind. What do you do?
Go to the cinema.
Oh, go. Okay, so she'll watch a movie. Okay.
Shopping or go sit beside the seaside.
So she takes advantage of the seaside. Okay. She takes a walk, goes and looks at the seaside. What do you do? She doesn't.
I swim. تبكي إذا ضايقت تبكي.
You do.
أنا لا أنا أمشي.
Oh, okay. You walk.
No, I listen to Fairuz.
You what?
I listen to Fairuz.
Oh, okay. Fairuz.
I swim.
She's a swimmer.
I eat.
You eat. Okay, we'll have to come back to that one. What do you do?
I face the thing.
You are such a strong person.
It's not strong. I try to arrange things in my mind.
In your mind?
That's all.
Get rid of it.
Get rid of it.
Why?
She's like, I can't take
because
it.
Because of this, okay, remove it.
Yeah.
I try to do this.
Yeah. 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 So she uses rationale.
Yes.
Yeah.
Like me.
I sleeping.
She sleeps. And so we will never get your personality and her personality together. Sleep and eat. What do you do? Exercise. Very good.
Meditate.
Meditate. Good. Good. Meditate.
Driving a car and go outside.
Yes, go outside. Perfect.
I swim.
Swimmer too. You can swim together.
I can do many things. Like, I don't have one thing.
Okay.
In the morning, I do my rituals and my reading. At the end of the day, because
when you get stressed.
when I'm stressed,
Yeah, like,
no, I go at the end of the day to my room and stretch out.
Now you are very stressed.
yeah.
Now I'm very stressed.
What you will do to get out from the stress? Now you are stressed.
I do a cup of tea and sit
Okay, that's
alone
good.
and
Tea.
read, do Instagram and
Meditation.
The weather is good. When I can't, I watch a movie or I'll talk about it with a friend to
Good.
get it out of my chest.
And that's good because then you are depending on somebody else. Yeah. And so the main goal to manage stress is to avoid being overwhelmed and neglecting yourself. And we already talked that each one of you, manage it well. We'll have to find another hobby other than eating, okay, and sleeping. We will never get you guys together. And that stress will induce very negative physical, mental, and emotional well-being. So don't put yourself at risk for that. Okay. And so how to manage stress? Understand the progression of the disease as soon as possible. Okay, because then you're setting up for the future. Know the community resources, and this is one right here, and we have a community resource here where people go out into the community and take care of the elderly population, mobile health care. And then we also have, I forgot her name, but we have someone from the other class who is actually starting Alzheimer's disease group who are specifically going out into the community and assessing the patients and their needs for any assistance. And then get help. And so it's okay to ask for help. It's okay to ask your sister and your brother or even a neighbor if they can help you out with something very simple. And sometimes it's not helping you out with the person. Yeah? And so if your lawn needs to be managed, if you need groceries and you can't go out to the store, simple things like that can relieve stress.
دائما مريض يعتني كمريض الزهايمر لا يعيش في كون بروحه. دائما يحاول لانه يتعامل مع مريض الزهايمر لفتره طويله يدخل في حالات نسميها ضغط عصبي شديد جدا يؤدي في النهايه الى المريض يمرض الشخص نفسه يمرض. فمن طرق الحل على اساس ان المفروض مريض الزهايمر او الذي يعتني بمريض الزهايمر يعيش في البيئه اللي هو فيها، المجتمع اللي هو فيه. في أكثر من طريقة، طريقة عن الشخص نفسه هو، لأن مثل ما سألت من أسئلة لو دخلت في حالة توتر عصبي شو أسوي؟ هاي وحدة. الشغلة الثانية نخلي الأقرباء القريبين يشاركون في مسألة رعاية مريض الألزهايمر، نستفيد من الخدمات اللي تقدمها الدولة. عندنا مثل الجمعية الثقافية والنسائية اللي تسوي ورشة، في عندكم رعاية المسنين الموبايلين التليفون المتحرك اللي ممكن يساعدونكم، في عندكم اخصائيين العلاج الطبيعي اللي ممكن هم يساعدونكم. في النهاية الفكرة شنو هي؟ إذا أنت قدرت تعتني بنفسك راح تقدر تعطي للمريض الألزهايمر. طول ما أنت تتمتع بصحة جيدة وطول ما غيرك يشاركك في الموضوع، المريض الألزهايمر يكون خدمته بطريقة أفضل.
Okay. And so never be so stressed that you're losing the stripes. Okay. So here the zebra stripes are falling off. Okay. And so this is a late stage. All right. And so what can stress do to us? We can have visual problems. We can have stomach irritation. We can also start to have high blood pressure. So our blood pressure is starting to trend up over time. And changes in our overall behavior, become very irritable, right? And then we also start to resent people. And so if you choose to be the primary caregiver and you choose not to allow other people to help you, when they start to come by and say hello, you start to resent them. Oh, now you want to come and say hello? Now you want to have tea time? Where have you been all the time? When you're creating a really bad cycle. Lack of concentration and then lack of eating habits. And so you're either eating too much or too little.
دائما في حالات الستريس او نسميه حرق الذات لدرجه انك انت خلاص تنسى نفسك، تدخل في مشاكل ثانيه اللي انت في غنى عنها اصلا، منها اللي هي ممكن تسبب لك امراض، عندها راح تصير مشاكل مثل ارتفاع ضغط الدم واللي يؤدي بعد ذلك الى السكر واللي يؤدي بعد ذلك الى ضعف البصر، كلها يعني امور مترتبه سببها نفسي ممكن علاجها في البدايه اللي ما يدخلنا في احنا نسميه دوامه الامراض النفسيه المسببه للامراض العضويه. كذلك نفس الفكره في ان حاله التقوقع اللي راح تعيشون فيه، لانك انت مجرد ما تعرف مريض الالزهايمر وتشارك الكل فيه، لو اجوك هي ضربت يعني مثال انه مثلا يو ناس طار يزورونكم في البيت او حد يزوركم في البيت، انت يكون عندك رد فعل عكسي، ليش يعني يزوروني؟ ايش حقه؟ شبهوا مني، لكن ليش انت عندك حاله هم ما يدرون عنها، لكن هم لو كانوا مشاركين عارفين البيت فيه الزهايمر، لما تصير مساله الزياره هم راح يشاركون بشكل طبيعي في العنايه في الزهايمر بشكل طبيعي جدا، بمعنى ان مريض الزهايمر ليس عباره عن شيء يخش في البيت، لا المفروض يكون معلوم للكل، المفروض نتقبل الوضع كما هو عليه، حتى لو الناس زارونا احنا عارفين انه في مريض الزهايمر، ممكن نكون قاعده معاه في نفس الغرفه مع مريض الزهايمر نفسه، حتى نتشارك منها الناحيتين، انت تنفس عن الستريس اللي فيك او اللي احنا نسميه، شغله ثانيه الناس تعرف شنو هو مرض الزهايمر، يعني الحين معظم الناس اللي يحكي عن الزهايمر اللي عنده زهايمر زين واللي ما عنده ما يدري شنو الزهايمر، لكن هو انت التفاعل في المجتمع اللي فيه لما تصير الزوار ويعرفون عنده مريض الزهايمر، الناس تصير عندها فكره، ممكن هم في النهايه يقدمون احنا نسميه يد العون اللي يساعدونك في انك كيف تعتني بمريض الزهايمر او يساعدونك في قلنا في البدايه اللي انك انت ما تحب نفسك بنفسك انت بروحك.
Okay, and here are some things that we end up doing when we don't manage our stress. We have denial, which I always tell people is a very dangerous thing. And so this is when you're not aware, okay? And so you will hear someone say, oh, I know they're going to get better. They're going to get better. And we have anger. And so this is someone who also does not know what's happening. Okay, they think that someone is doing it on purpose. Why does he keep saying it again? And so you'll hear someone say, oh my God, if my dad asks me the same question one more time, I'm going to lose it. Okay, a social withdrawal. I don't care about going out today. I have to make sure that my dad is okay. This is my primary concern. Okay, don't ask me to go anywhere else. I can't do it. And then we have anxiety. What will happen if he needs something? he needs help and I'm not there. Okay, who's going to do it for him? And then you start getting very anxious.
بالنسبة اللي يعتني مريض الزهايمر دائما يضع نفسه هو تحت المراقبة. إذا ظهرت فيه الأعراض الأربعة هذه لازم يعرف نفسه إنه دخل في مرحلة التوتر خلاص، مفروض إنه ينسحب من الوضع اللي فيه. أولها اللي هو إنكار الذات، تفرغ التام بمريض الزهايمر. الشغلة الثانية العصبية من أفعال مريض الزهايمر نفسه. ممكن يصل لمرحلة إنه خلاص ما يتحمل إنه نسوي مثال مريض الزهايمر مع مشاكله إنه يكرر الكلام أكثر من مرة. فأنت لما تكون منهك تماما لو كرر الكلام أكثر من مرة تدخل في حالة غضب. هو مو مسألة الغضب اللي دخلت فيها إنك أنت أصلا منهك. يعني المشكلة صارت فيك أنت مو في المريض. الشغلة الثالثة إنك أنت ما تبتعد عن المجتمع اللي أنت عايش فيه، لا زواج ولا عرس ولا عزل، خلاص منعزل وقاعد أنت في البيت مع مريض الزهايمر. هذه أحد الأعراض اللي تنتبه فيها لنفسك إنك أنت دخلت في مرحلة أن نسميه حرق الذات. الشغلة الثالثة اللي التوتر اليومي، لو طلعت عن البيت أو عنه شو بيصير فيه؟ دائما السؤال شغال. لو 4 شغلات هذه بدت معاه يعرف انت دخلت الان في مرحله اللي هي نسميه التوتر العصبي الشديد اللي انت فيه، ولازم تطلع مباشره.
And so we have an example of depression, and these are later signs where someone is just going to say, I just don't care anymore. Whatever happens, happens. I just can't. I can't take it, and they're very subdued about it. Exhaustion, I'm just too tired for this. I can't flip him over one more time. I can't change another diaper. And sleeplessness, you will say to yourself, if she wanders, what if she falls? What if she tries to get up in the middle of the night to get something? And so you stay awake the whole time. And then irritability, and this is, who wants to be around an irritable person, right? And so this person is saying, just leave me alone. I told you, just get away from me. I don't want to talk to anybody.
تكمل عن الجمال الأعراض الأربعة الاكتئاب، كذلك العرض الخامس يكون موجود. عندنا اللي هو الإجهاد التام. الإجهاد التام بمعنى انك انت المريض الزهايمر على سبيل المثال لازم تغير له حفاظه، توصل لمرحله انك انت حتى ما تقدر تقدر تقوم تأجل. بعد ساعتين انت هي دخلت في دور الإجهاد مع مريض الزهايمر. في عندنا اللي هي نوم متقطع، نوم متقطع. ان لما اول ما تغفي اذا غفيت شو بصير فيه؟ فهني عندك مشكله في النوم كذلك. وعندك اللي هو الانسان اللي نسميه نزع، هذا لو قعدت في البان لا ميعه ولا وين تفصل الطاقه انه ممكن يتحوش مع نفسه.
Okay, and so we're passing out bags right now. Just don't open them. Okay. Just don't open the bag.
تجربة لكم راح نقول لكم بالضبط تسوون الكيس. أحد يفضل الكيس ويشوف شو اللي داخله.
Okay, and so the main thing is that we want to stress right here is highlighted in bold for you is that you cannot feel guilty. Okay. Because you know that you're trying to do as much as you can, and you're trying to reach out to people to help you, and you're trying to provide the best care possible. And so don't feel guilty at all, because we understand that the disease is going to progress. Okay?
أهم فكرة في فرق المجتمع مريض الزهايمر أو المعتني بمريض الزهايمر لازم يعرف شنو مرض الزهايمر. لأن ما نبي يعيش في النهاية في مرحلة تأنيب الذات أو تأنيب الضمير. لأن لو دخل في مرحلة تأنيب الضمير، لأن أحد أسباب دخول في تأنيب الضمير إنك ما تعرف المرض شلون تطور، وشو اللي صار، وشنو مراحل. هي المشكلة. دائما يعيش في فرق الرضا ومن المرض له مراحل ولا نهاية في النهاية.
Okay. So just bear with me here. Okay. And so those of you that were here for both days, you know that we talked about the changes that happen during Alzheimer's disease, okay? We talked about vision, we talked about speech, we talked about sensory, we even talked about gross motor. I think is it this? Okay. We talked about hearing, and so all these things are going to change. And so what you have in front of you is a simulated package, okay? And so it's a very easy way for you to kind of experience what these changes are going to be like, okay? It's not 100%, but it's going to give you an insight of what it's like, because we're never going to feel what it's like. Okay, as long as our brain is cognitive and we don't have any impairment, we'll never feel what it's like to have this disease. Okay?
اللي يشعر فيه مريض الألزهايمر شنو قاعد يحصل معه؟ شو المشكلة اللي تحصل معه مع النظر، مع السمع، مع الإحساس، شو اللي قاعد يصير معه بالضبط؟ التشخيص هذا عبارة عن تعريف بسيط عن مريض الألزهايمر اللي هو الدور اللي عايش فيه.
Okay, and so once the music starts, you can open the bag, follow the directions on the envelope, okay, and then I will meet you right here at the end.
لأن شيء مكتوب على الظرف.
وبعدين نكتب على الظرف.
الفلوس اللي معاه، بعدين نقرأ التعليمات اللي داخل الظرف.
Don't forget to put your glasses on.
I have my glasses.
You take your glasses off. And so put the glasses on. Put the yours come off. Yeah, تبعينك كليهم. الله يعين. هي شيلوا الشاشة. That's exactly the point.
No, without this I can't see. I have to put this one.
Yes,
this one.
Yes. Okay.
See? Like this.
Okay, يلا.
It's a different than the morning, this noise.
No, it's the same.
No, it doesn't.
No, it's the same. Okay, but you have to put them on all the way. All the way. There we go. Okay. Yeah, it's still the same. Yeah. Is it any different? لا. The caramel.
Where is the gum?
This, the caramel.
By this?
Yes. Yes. She saw it. Are you done? And so now you have to open this. You don't think you can read with it? I have to find you. I'm gonna bring you big glasses next time. You put the corn in the shoe, so you can step on it. In the bag. You put the bag.
I put this one.
What I put? This. You're gonna step on this. So put this in your shoe, and put this in one shoe, right by the ball of your foot.
How are you? And I told them put the bag.
This goes in your shoe. Yeah. So when you walk on it, okay? She was opening the caramel with her mouth. Do you have the corn in here?
Yeah.
The corn, how does it feel? It's uncomfortable?
No,
No? هات أفرجيكي.
You said, I said the
bag
bag.
of corn?
Bag of corn.
Yeah.
Okay.
Do you have the corn in the shoe?
Yes.
How does it feel?
I like it.
Isn't it uncomfortable? Look at her, she has high heels on.
Yeah.
And so if you try to walk, your shoes don't fit
The
right.
problem is the glasses, not the
The
shoe.
glasses too, they're supposed to change all your senses at once. Yeah. And so if you walked around the room a couple times, it would be so uncomfortable. Yeah? Yeah? You couldn't do it? You couldn't do it? We're all one. We're all one.
Right?
Yeah?
But it's no bag.
You could take it. It's for you to keep. Yeah? You're all done. Here.
Should I keep these?
You can keep them. Yeah.
Or I put them back in the bag?
No, it's yours. You keep it.
It's
I think this is yours.
Do it for your...
Thank you.
Where's the Dora? Where's the Dora? I told you how the Dora. You ate them? I did. Yeah, you could take them off. Yeah. Go figure, she gets red gloves to match her red scarf. How are you doing?
Fine.
You're doing fine?
Yeah.
Are you eating?
Tofu?
Caramel?
Yeah.
Yeah?
Okay.
And then these go, okay. And those go in your shoes.
I know.
Okay.
But these are popcorn?
Popcorn.
Change the
Yeah. Yes, you can have it. I have extra too. Oh, okay. ايش شو صار بكم؟ شو صار؟
شوفوا وقعتها
خلصتوا؟
ما شفت.
What is this? What is that right there? The line.
ما تشوف.
The line with caramel. Did you eat it? Yeah.
Only one.
Only one?
I am dieting.
Oh, don't. Okay. Yes.
So this is
And so if you put all these in your mouth, what will start to happen?
these
Caramel.
caramel. I will choke.
You will choke. Too much saliva. Spit. Okay, it will be difficult to talk. Yeah. And then if you put these in your shoes and step on them.
Tickle.
Yeah, try it. Try put those in your shoes. You will spoil me. Or don't take it out. Just put the bag in there. She says she'll spoil her shoes. أهلين.
have been terrific.
Thank you. Thank you so much.
It's very nice of you.
Thank you.
Thank you very much.
Thank you for coming.
And I am sorry for interrupting sometimes, but it's, we have to.
Yeah.
And sometimes I feel that, sorry, I didn't give what you really want to say. I felt with you.
I know.
So I was sometimes eager just to relate.
Yeah, I understand. I understand.
Because this is my area.
Yeah, it's yes, I know. Good.
So this is why.
Good. But thank you for taking the time out of your schedule to come, okay? Shukran.
I hope to see you again.
Inshallah.
Have a safe trip.
Thank you. Thank you. Okay. So let's do a summarization of how you guys felt, and then the class will be over. Okay. They're running away. So how did you feel?
الفيدباك مالكم بالتجربه اللي سويناها شو اللي حسيتوا؟
Yeah.
عايش في darkness.
Yeah.
The in-laws of my daughter arrived and they having dinner.
Okay.
I'm sorry. I want to stay.
Thank you so much for everything. Shukran. Anytime you need anything, just let me know.
I hope you are satisfied.
Yes.
ما قصرنا بشيء.
لا, thank you for everything. يعني it's an honor to come here again and to work with you. Inshallah. I will think of more things. لا حديثة. Yeah, I'm gonna have to get you.
Send me.
Inshallah.
Okay.
Inshallah.
Which number? First number I call you.
Yes. Your mobile? Your mobile phone? Yes. Okay.
It's 9982.
9982. Okay.
After the
Okay.
Thank you very much. It was very good.
I love it. Okay.
بالنسبه لنا
Yes. I think we're done.
هذا بالنسبه للزهايمر يسمع كذي يسمع ازعاج التواصل 24 ساعه
أنا سامع
ما يسمع صوت النظر الملمس الاحساس اللفظ المشي تعمل
Sometimes you might try to swallow the whole caramel block. Okay? And then he already explained that means. And so sometimes it's hard for you to concentrate. I asked you to write it too. And so you have your vision distorted and you try to hold the pen while you're the sensory was decreased. And so just understand that in an Alzheimer's patient, this is not all everything like this all at once. Does anybody have any questions? Because we're basically done.
Yes.
Yes?
For the Alzheimer patient, is it possible to change the caregiver?
It's better to have not just one caregiver, but two hours. scaring them, and they keep asking you, what is this? You know, someone's trying to come in. Then you can change the furniture around, yeah, because you're assessing a behavior. And so, you know, I always say that if you're going to do something, do it with purpose. Okay, don't just do it because, you know, the season has changed and you want to change the rotation of things, but try to do things because it's purposeful.
Is it good to have the TV on all the time?
This came up in the other class too. You know, the television, when we have it on because we're not stimulating the person and we're expecting them to watch it, or they find something interesting in the TV. And so it shouldn't be your only form of activity. And so if you have the TV on, it's okay, but some things they might find disturbing. Yeah. And so someone said horror films, every time they see something scary like that, they just get very panicky. And so we can't monitor the TV, really. We don't know what the next commercial is going to show. And so it makes life really difficult. But they may really like soccer, for example, and maybe ask you, can you put a game on? And they might repeat it over and over. And so you might try that. You might try to put that on. But it shouldn't be the only form of stimulation. You know, we have radio, we have Quran, we have instrumental music, you know, without words. Maybe they do want to hear, I don't know, someone said Fayouz. Yeah, and so maybe he or she wants that. And so you can do things like that. What do we do if they refuse to do the medication? We have this problem in the hospital all the time when the person doesn't want to take the medication. And so you have to be very careful because some medications you can't crush them and you can't cut them, but there's ways to be creative. You can put them in food. And so you have to figure out what's their favorite food. If it's pudding, if it's salsa, if it's applesauce. I had an aunt who we were able to put the food in fruit.
Food and fruit?
Yeah, put the pill in fruit.
Oh.
Yeah.
No, she takes the dose every day normal.
Yeah.
Suddenly one day she doesn't.
Yeah, and that's
not
why
because any problem of swelling or anything. No, just like that.
Yeah, and so you know their habits are going to change, and so we just have to be very creative. We have to anticipate that the habits are going to change, and we have to be ready for that. And so you just have to think to yourself: is this a food that I can crush? A pill that I can crush? Is this something that I can cut in half and give to her throughout her meal? Because she's going to need it, and you have to know the consequences if she does not take certain medications. I mean, we say the same thing in people that have hypertension or diabetes. They have to take their medication or there's going to be consequences. So in this case, you can, you know, the internet has a lot of scientific resources on medications that will tell you whether or not you can crush or cut a pill if the pill is scored, if it has a line on it. But you should also talk to the primary doctor because sometimes the pill comes in a liquid form, okay? And sometimes the pill comes in a patch form, okay? So you can adhere it to the skin. And so communicate with the healthcare provider because there are always options out there.
Many patients, they end in the corner of the house.
Yes.
In a room. Yes. Excluded. Yeah. Even close friends are deprived from seeing them. So would you think that this is...
It's sad.
Is that the proper way to keep away the patient? No, they don't want others to be affected by...
Yeah. And so,
what's
a lot of the books and you know, the how-tos out there tell you that if someone is going to come and visit the person that has a disease, they should be prepared. And you can have a conversation with them. You know, I just want you to know that my mom, she's not having a good day, for example. Okay? It was really difficult to get her out of bed. She really didn't want to do any tasks today. And so maybe today is not the best day. Let us reschedule it for tomorrow. Okay? And if they call tomorrow and you tell them, she's having a good day. However, I just want to prepare you that if she has any outbursts or if she starts getting angry, don't be shocked. Okay?
There is one question asked in the first session yesterday. How can we diagnose ourselves that we are in the
How can we diagnose ourselves?
that we are in the process of being
How can
patient?
Good question. They always want to diagnose themselves. They always want to, okay, let me say your question. So how can we diagnose ourselves?
Yes. Yeah, and how can we be alert that there is something wrong, go and check yourself.
Yes. Okay, so Kifayah needs to have knowledge that maybe there's something going on with me and I need to go to the doctor?
No, if you want some symptoms.
With yourself?
Yes.
Because to find it in yourself is more difficult than to find it in somebody else.
Okay, somebody else.
Yeah. And so someone else, it's it's a little bit easier because we're aware of other people's behaviors. We observe them all the time, and sometimes we're overly critical. And so if you remember in stage 2, it becomes an issue when they're unable to perform tasks and obligations that they were able to perform readily before. And so their coworkers start to pick up on that. And their family does too. Why aren't you working? How come you haven't finished your presentation? Why are you spending every night until 3 o'clock and you're frustrated and you're not meeting deadlines and you're stressed out? And why are you always misplacing your keys when they're in the same place? You can't retrace your steps. And so that's when it starts to become a problem. But in ourselves, it's more difficult. A lot of people don't go to the doctor and say, I think I have a legit problem. 100% I think I have a memory problem.
Denial.
Yeah, it's denial. And so nobody wants to admit that they're in the second stage of Alzheimer's disease.
No, the first stage in others, for example, a husband,
هي الفكره كلها الزهايمر عباره عن مرض عصبي. المرض العصبي هذا يصاحبه امراض عضويه ونفسيه. فاذا مريض الزهايمر يصيب بالسكر او يصيب بالضغط فما نخلط بين الاثنين. هذا مرض وهذا مرض. اللي يحصل دائما ان للان الصوره عن مريض الزهايمر ما هي واضحه. شنو هو؟ هي على اساس ان عرفناه في البدايه هي عباره عن مرض عصبي لا علاقه بالخلايا العصبيه الموجوده في الدماغ لما يحصل فيها ضمور او يحصل فيها بلوك يبتدي تظهر اعراض مرض الزهايمر. لكن ليس اذا كان المريض من قبل في سكر هذا قضيه ثانيه، معاه ضغط هذا قضيه مختلفه. اعراض الضغط والسكر قد تعطيك اعراض مشابهه لمرض الزهايمر وليس العرض الاساسي. يحصل عندنا يعني امراض بالذات الامراض العصبيه تعتبر من اكثر الامراض اللي يحصل فيها صعوبه في التشخيص، لان احنا عندنا في مرض ثاني قريب الشبه من مرض الزهايمر اللي هو الباركنسون. زين في تقريبا الاعراض تتشابه تماما، لكن هل هو في باركنسون ولا هو في الزهايمر؟ اي واحده قبل الثانيه نفس الفكره. وهذا واحد معانا على سبيل المثال فشل كلوي دخل في مرحله الفشل الكلوي الاول تبتدي تظهر عندنا في البدايه اعراض الزهايمر، لكن هل هو زهايمر؟ احتمال مو زهايمر، احتمال مشكله البوليه اللي ارتفعت ادت الى اعراض شبيهه للزهايمر. زين او عنده ارتفع السكر بطريقه عاليه جدا ظهرت اعراض شبيهه للزهايمر. فالفكره في البدايه راح تكون احنا متى نقول مريض الزهايمر؟ لما تفقد عنده 4-5 خواص ثابته خلاص غير متغيره. هني نقول دخل في الزهايمر. لذلك يعتبر الزهايمر في المراحل الاولى والثانيه والثالثه تقريبا صعوبه التشخيص. تشخيصه متى يتم عندنا؟ المرحله الرابعه والخامسه والسادسه والسابعه. النسيان المفتاح بعض المرات ما يكون سببها الزهايمر. النسيان المفتاح كمان يكون من الضغط العصبي اللي انت عايش فيه، او من ان الضغط ارتفع، او ان ما نفسك اليوم اصلا تتحججين بسالفه انه والله تضيع. يعني الفكره يعني ما زالت دائما عندنا التشخيص متى يتم في النهايه. في النهايه احنا ايش قاعد نقول؟ الفكره الاساسيه في البدايه حتى ما نبي نصل للنهايه.
طيب دكتور هو مرض متدرج؟
نعم.
يجي بالمرحله الاولى وبعدين يطلع؟ او يعني ممكن suddenly come to stage 4؟
لا ما يجي متدرج. هو مرض متدرج.
طيب لو كان العكس I have a patient now عنده مشاكل طبيه وايد heart, kidneys, diabetic, blood pressure, and then you got the Alzheimer.
هني النقطة اللي نتكلم عنها هي هو في أعراض الزهايمر ولكن مو مريض الزهايمر. زين؟ زين؟ يعني الستروك ومشاكل القلب ومشاكل الكلى ومشاكل السكر والضغط عطت عليه أعراض احنا نسميه العته أو الشيخوخة، وهو عرض رئيسي موجود للألزهايمر، ولكن ليس الألزهايمر. نكون واضحين، الألزهايمر مشكلة في الأعصاب الدماغ نفسها. إذا ما أصيبت، إذا ما معي ألزهايمر، لازم يكون في إصابة في الدماغ.
هذا شلون يعرفونها؟
سيتي سكان. والسيتي سكان نفسه بعض المرات ما يعطيك التشخيص الواضح. اثناء السيتي ممكن يصير عنده ظهور سببه جلطه مو سبب الزهايمر. فهذه مشكله ثانيه تحصل. فاحنا دائما نقول الفكره كلها تنشيط الذاكره قد ما نقدر. هي ميزه الذاكره كل ما نشطت وحفزت ابتعد المرض مسافات ابعد وابعد.
Is it genetic?
So you will have people that say that it is. And it's just like different theories out there, you know, like today we had people say that specific fruits and vegetables will prevent it. Okay, how can you prevent it? Eating coconut is going to prevent it, you know. And so you have to be very cautious about what you read and what you hear. Okay, they will try to make associations. You know, they had this really good documentary on 2020 or ABC where they brought an entire family and they sat them up and said, you know, how many of you have Alzheimer's disease? And each one said, I have it, I have it, I have it, I have it. And so, you know, you have to really think about something like that. You know, what's the probability of them all having it? You know, maybe they do. By chance, by probability.
هي لم يعني يثبت علميا ان مريض الالزهايمر انه ينتقل من خلال العائله او بمعنى صح او خاطئ. شو اللي يخليه يظهر كانه مرض وراثي؟ نرجع لنفس النقطه الاساسيه. زين اللي هي فكره الاعراض. العرض لما يتكرر في اكثر من شخص في اكثر من عيله ويعطيني انطباع كانه الزهايمر نحس انه والله مرض وراثي. الابو كان فيه بعدين الابن بعدين الابن ومو شرط انه يكون هو انتقل من الاب للابن، لا يصير المرض هذا انتقل للابن الاعراض اللي كانت انها تضخم فيه تتبين كانها مرض وراثي. هذا الاشكاليه اللي ممكن مرض الناس يفكر فيها. هي قالت على نقطه اهم شغله في مرض الالزهايمر دائما نحاول نوسع او نخلي المراحل يعني نطول المرحله قد ما نقدر. الفكره الاساسيه في الالزهايمر نطول في المرحله. مثلا لو دخلت المرحله الاولى او الثانيه نحاول نطول فيها قد ما نقدر. في نظريات وايد منها الفيتامينز، منها النظريه الجديده اللي طالعه اللي هو يستبدل زيت الطبخ بزيت جوز الهند الان طالعين فيها النظريه هذه الجديده اللي طالعين فيها احنا نسميها الانتي اوكسيدنت موجوده في الفواكه ممكن تحسن. هي الفكره موجوده ما نقول مو موجوده. هل هي بالفعل تمنع المرض؟ هي ما راح تمنع المرض. هو اي نعم نعم
انت تبني موقف لنفسك. بمعنى انت لو كانت حياتك وانت اكتف نسميه ممكن 15 سنه 30 كانت حياتك اكتف وتعيش في نشاط وتحافظ على نفسك وتاخذ وجبات صحيه، تجد اثر بعد سنتين. تجد اثر الشيء هذا انك انت بنيت جسمك بشكل طبيعي، لكن اذا انت من صورك مهمل تجد نتيجته لما توصل سن 30 يظهر بعد ذلك. يعني مثل مثال واحد ممكن بالعيله عنده سكر، لكن انت حكيت بنفسك ما راح يظهر السكر في نفس السن اللي ظهر فيه مثلا الوالد او الوالده اذا انت اعتنيت بنفسك، او ممكن اذا انت مو معتني بنفسك يظهر قبل. الفكره وين هي؟ انت تبني نفسك بنفسك حتى في مساله الازهايمر. طول ما انا معتني بنفسي محافظ مسوي اكسرسايز مسوي الامور هذه كلها، الاسبان المسافه ما بين الدرجه الاولى الثانيه الثالثه راح تزيد راح تزيد. فبدل انا ما يظهر المرض خلال 4 سنوات ممكن يظهر خلال 20 سنه او خلال خطوات يعني او خلال 30 سنه. فيبتعد المسافه. نعرف ان الامراض هذه نسميها الامراض المزمنه، يعني هذه ليست امراض الطارئه وقتها وينتهي، لا هي المشكله انها تاخذ وتشتغل بشكل بطيء جدا.
بس اللي ما غير في فورمه عندكم
تقييم الدورة
والشهادات قبل لا يروح.